I want to welcome into the platform studio now someone who was invited in last week, and things have happened since then, and we all know about that. And that is Dr. Matt Shelton, who's with us. Thank you for coming in, Dr. Shelton. Good to see you.
G'day, Paul. Thanks for having me.
You are here. You were invited. You are here. Many people will know your name, and ears are pricking up right now. But for those who may not know who you are you? What have you been doing in your career up till recently, and what have you been doing since? Just a quick painting of the picture, if you don't mind.
Sure, Paul. Well, I've been a doctor for 37 years. I've been in New Zealand for 24 or so. Most of my time in general practice, primary care, and up until last year, I was a GP at Plymouton. Me and a number of other doctors, a handful of people had already been posting on social media some concerns and some thoughts we had around the pandemic and its management. And then I got suspended subsequently by the Medical Council. And then I won in court and won the right to be reinstated. And the Medical Council promptly resuspended me again. And then my practicing certificate has subsequently lapsed. And there's one or two barriers to getting it back again at the moment. So technically I'm not I'm not able to practice as a doctor. I can still call myself a doctor. I have a medical degree.
Right.
It was a hard one. So for the last year or so, I've been involved with NZDSOS, which is a collection of doctors who got together early on and really just asked questions. We just asked questions and raised concerns. Given the strength of the narrative, the apparent confidence of the safe and effective message that we felt already back then there was no certainty, and it wasn't possible to make these blanket statements. So we just wrote a couple of letters, really asking questions, and were met with complete and utter silence from the government, from the Medical Council, from the GP College, from MedSafe, complete silence, and that's been the playbook really. So we knew immediately that A, we were in trouble, and B, this was probably going to be worse than we actually thought.
How many patients have you seen? I'm trying to get an idea of the sort of experience you've had and how you're able to discern over a period of a career, and thousands of patients, consultations? Oh
yes. Every now and then we sort of do I'm sure we all do a back of an envelope, totting up calculation, but it's tens of thousands.
So
I'm
you've
sure
seen
by now
a huge variety of people with everything under the sun that a GP.
Yeah, I've worked full time pretty much most of my career. I've been consecutively registered every year since I graduated in '85. So I'm as experienced really as anybody else my age, for sure.
Because doctors like you have been kind of marginalised, demonised even. So what was the problem you had early on? Go through that. What rang the alarm bells in you?
Well, we've got mileage on the tracks. Many of us founding doctors were pretty experienced. We've had lots join us since then. And we're all in agreement that what's going on is completely unprecedented in terms of the rush job, really, of the vaccine rollout, the lack of any significant safety testing, any human trials. 2 months and that was it in humans. And they said, 95% effective and safest vaccine has ever been. And time has told, clearly everybody's getting COVID. The vaccine has not been effective. And that was one of the questions we asked at the beginning. And it's very cold comfort to look back at those letters and to see that every single concern and question that we asked, as far as we're concerned, was valid and has been shown to have been a really important question to ask. And the answers, are not great.
Perhaps people struggle with trying to work out why, over the history of medicinal drugs and the testing regimes that, no one's an expert, but people assumed took place, and probably did. I don't know about medical history too much, but, things were tested and proven to have a certain level of safety. Number one, obviously effectiveness in treating whatever. Why was all that suspended for this?
Panic. The world was panicking. We were all told this was going to be a disaster. very high mortality rate. We were all told initially it looked like maybe 3 or 4%. And the world essentially said to the drug industry, help. And the drug industry said, well, fine, we can help, but there'll be no safety testing, and you'll need to, give us a liability waiver in case things go wrong. And the world said, sure, where do we sign?
That's insane.
Well, a lot about, it feels like society's insane to some extent. It is, because very quickly it became clear that actually the fatality rate was much, much lower than the initial projections. The WHO and some very well-known epidemiologists, statisticians came out and said, look, it's looking like a typical seasonal flu, actually. But by then, it seemed like the juggernaut was accelerating.
Yeah, I remember that, finding out or it becoming apparent that it's not as serious as the first comments made about this disease. It wasn't long before people were saying, hey, it's not that bad, here are the numbers. But that didn't seem to stop anything or slow anything down. And that was early on.
It didn't, and as time goes on...
Can you explain that?
Well, as time goes on, there's some good evidence that points to a degree of pre-planning and foreknowledge, and the platform of the vaccine was certainly ready to go. And I do need to remind people, though, that I'm currently not registered as a doctor, but I was when all this came out, and my views are obviously violently disputed by the medical council, but I'm still entitled to them. They have their views, I have mine, and we have ours. But look, I have to say, one of the things they've said all along, and more recently they've said it in court and in writing, is that they don't have to challenge or test our medical evidence. They don't have to produce evidence in support of what they say. Essentially, we need to toe the line.
How do you run that argument?
Well, that's very hard. And in fact, judges have said the same thing. They are saying in some of the court cases, look, we're being given two parallel streams of evidence, and the Crown will not engage with the expert evidence that's being brought. So what are we to do? And generally what they're doing is defaulting to the Crown and the Crown's experts, and it's the same old sort of talking heads that we keep hearing. So there's been a lot about this that has stuck out like a sore thumb to me and many others. Not just the unparalleled lack of testing and lack of knowledge around the short, medium, and long-term possible problems of this vaccine, but the fact that we're supposed to swallow this and we're not supposed to say anything that would dispute the government narrative. We're supposed to stop doing what we've all done all our careers, and which we've been threatened, if we don't do, which is to have informed discussions with our patients and to, as best as possible, get their fully informed agreement as to what treatment program or course of treatment they'd like to undergo. Because a very important precept of ethical medicine also is that you always have the option of declining and choosing not to do anything. And yet we've seen this unparalleled situation, this atmosphere of force and coercion, and some people have literally felt, tortured into doing something that they wouldn't ordinarily do because their circumstances. They're so reliant on their income, pay their mortgage. They love their jobs, and some have walked and are paying that price too.
Although the strong ones, I would imagine, when you've got a lot of at stake.
Everybody's circumstances are unique and different, but there's been a one-size-fits-all, approach and pressure.
You're a slave to the conditions like mortgages and futures and paying for kids' education. It's a lot to put at stake. So surely the experts, what do you think of that word experts now, by the way?
It's a very loaded word, isn't it? It's so subjective. So subjective.
But it's used a lot, and it's kind of part of the messaging. I mean, I don't know anything about medicine, and I've been watching this very closely. I was involved in the news side of it early on when I was at RNZ, and the whole thing was rolling out. And I'm not the brightest spark around, but I could see where this could go with the speed at which it was moving, and like you say, the common sense, the lack of common sense in testing and doing the due diligence, I don't know what the term is, before you put this at mass 95% of the population. mass scale on a population. We're not the only ones. But you put your foot on the gas. You must have thought about the psychology of that. The experts, the best brains in the room. It's obvious. I could have rocked up and told them that. Hey, watch out for this. This could be a problem. What's happened, do you think, to these decision makers, to these experts? Have they been possessed by this?
I think that's a very good way of putting it. I think a lot of them were scared witless at the beginning and, bought into this whole idea that we've got to do something fast. And if we don't do something now, we could be really badly criticized. But it was only a couple of months into the thing that it became clear, actually, that we had, misgauged the severity of the illness.
That was the point I made before. It was pretty soon that people were realizing, and way in time to put the brakes on.
But then, contracts have been signed. In fact, deals were done even before Pfizer, for instance, even had a product, as far as we knew. The government had signed away, had given them freedom from liability. I don't know what the financial deals were and what the clauses were in the contract, because nobody's been able to find out. Certainly not in New Zealand anyway. But the government's behaved as if it's not allowed to do its own independent testing, because we've raised lots of issues around safety and the sort of the purity of the products and things, and they've just consistently refused to engage, to even have a look. So I mean all that information evidence has been with the police, it's been with the MedSafe. We've written over and over, and there's really not much more we can do in the face of these institutions. As far as we can tell, refusing to do their jobs. They're there to regulate and protect the public good. So, nobody's disputed most of what we've said. There's just been a silence and a refusal to debate and to engage.
And that's what we're doing right now. I remember getting a call from my medical centre early on in this, and it was like chasing me up to get vaccinated. And I said to the very nice woman on the phone, nurse or whatever, I said, "Can you tell me what's in it?" Couldn't. Didn't have a clue. I said, "Has there been adequate testing of it?" "Oh, yeah. Yeah, MedSafe's approved it." I knew that wasn't the case. And I said, "From the information you can give me, do you think I can achieve informed consent?" Basically hung up the phone at that point. Them, not me. Wow.
Not a perfect world, is it?
But, people are entitled to have those questions answered faced with a decision like that, surely.
Well, in a normal world.
Normal world. Why? It suddenly went not normal.
Well, there are obviously explanations somewhere. And I wouldn't claim to be an expert in a lot of that. But I do feel I have a right to my view on the science and what's normal. And there've been a few high-profile disasters with drugs along the way. I mean, I narrowly avoided having my mother take thalidomide, for instance.
Right.
But most people who took thalidomide didn't get the dreadful congenital abnormalities.
Yeah.
It took about 5 years of its use before it dawned on people.
The numbers were obvious.
That actually the numbers were increasing.
Yeah.
So it was relatively rare, but it was catastrophic if it was you or your child. And there'd been normal length clinical trials for the time. Vioxx is another one more recently, very effective anti-inflammatory. And eventually it emerged that the drug company was sitting on data that it knew showed that it wasn't nearly as safe as the clinical trials seemed to presume or seemed to show. And you get that. And quite a long time for some teaching I was doing, at the time it was clear that around about 20% of all medications that are released onto the market in the Western world are withdrawn in their first year of life.
Wow.
Because they're shown to be more harmful or less effective, or both, than the clinical trials seem to suggest. So, they're not the last word. And it's not until you get what's called the post-marketing data, where the drug companies are following up, and ideally the regulatory authorities are as well, what's happening in real world, full market use, that problems may apply. And it was very clear with our product here, the Pfizer one, that Pfizer knew about problems, within 3 months of the first rollout and its use in the UK and the States, that there were big problems. but we only just heard about that, last year. It wasn't made clear, but certainly the regulators would have had it. We know that Public Health Victoria had that information. We're almost certain that MedSafe did.
So, hang on. You've got that information, yet you still got your foot hard on the gas.
Seems to be what's happened, doesn't it? And you'd have to ask these people for the reasons.
Well, no one gets an
won't tell
opportunity.
you because we've been asking and
No one will tell you. And the media doesn't ask, and we'll get onto that at some point in our discussion, I hope. I want to get back to this waiving of liability. You never do that in a business transaction. That is the outlier. That's not the normal. And another thing too, to go with that, is that I think a while back there was a leak of how much the government was paying per dose. Someone leaked it out, $36 or something. And the response from Christopher Hipkins at the time, he might have said more, but this is what I saw quoted. The only concern he seemed to have was Pfizer might be upset with us. So, putting the piece parts together, I mean, why would he be worried about?
Well, he knows what's in the contract.
He's the customer. Customer's always right. We're paying the money. I mean, it seems like an unnatural business relationship.
Well, if you remember, there was huge fear around whether we'd be, where we'd be in the queue to get a vaccine. And even calling it a vaccine is really explains so much of what's happened.
Could you define, is it actually in the classic definition a vaccine?
Well, no, it's not. You can define it a number of ways and it doesn't meet the grade, but by labeling it as a vaccine, it gets a shoe-in with people who are used to using safe and effective vaccines. And I mean, people might choose to call me an anti-vaxxer, but I've been vaccinating my whole life. I've given way more injections, I'm sure, than the chairman of the Medical Council and some of the doctors in the Ministry of Health who don't actually see patients.
Yeah, that's why I asked you first up how many patients you've seen over the time, and I was going to at some point get to, but now you've mentioned it. Do these people have any real world experience?
I don't think so. To get to be a public health specialist or an epidemiologist, it's about learning the topic and doing research, and you may be involved in a bit of clinical trials here and there, but you don't actually consult one-to-one with patients day in, day out. So I think they do lose some of the nuance and
there's a lot of nuance
and the sense of the individuality and the uniqueness of the person you've got in front of you, and also the reality of the situation for them. If they make a decision that goes badly. But if I could just reel us back a little bit, the other thing that labeling a vaccine does is it can give us a false sense of assurance. Oh, it's just a vaccine. More vaccines are all
because people are used to vaccines.
But it doesn't work as a vaccine. It does not stop you being able to contract the illness, COVID-19. It doesn't stop you being able to pass it on to other people. And in fact, there's very good data, including the government's own official data, and from many countries overseas, especially that are heavily vaccinated, that actually the opposite is true. It may well make you more likely to go down with COVID, and that's I'm going to say that's pretty strong evidence.
Because look at our country. Well, it's 90. What do you think the real figure is, by the way, on vaccination?
Well, I mean, the beeb has just been caught out lying in its teeth. It said that 8% of the UK remained unvaccinated, and why was that? And they were corrected fairly quickly by a statistics professor in the UK, somebody who's actually given expert evidence in some court cases here, actually, a guy called Professor Norman Fenton.
Right.
And he says no, it's 30% are unvaccinated in the UK, including children who are not yet eligible, the under fives, and 20% of all people that are eligible have not been vaccinated. So I do wonder about the similar figures here, and there's been a lot of things that aren't true that we've been told. So who the heck knows what the actual truth is?
Okay, well, I was going to say with our vaccination rate, people seem to be falling like flies who've had this.
Well,
or is that anecdotal? How do we know?
Well, not even our government. Anybody in the government anymore is trying to pretend that it'll stop you getting COVID.
Because they started off with that sales pitch, didn't they?
Well, look, that 95% effective thing, you could look at the same numbers and look at what your actual statistical reduction in risk from that first clinical trial with 40,000 people in it, and it actually came in at less than 1%. Because there were a large number of people who didn't get COVID in that trial. So the best that you could say was that, I think it was 0.84%. And this is one thing that's been done for years, muddling what's called relative risk reduction and actual risk reduction. Because you've got to look at the number of people who are destined to get this infection in the first place. And it varies from year to year with influenza, for instance. The flu jab varies between sort of just under 20% and maybe 50% in a great year, reduction in risk. But that's relative risk, because most people aren't destined to get the flu in any particular flu season anyway, or at least a majority won't. So you can do what you want. There's a saying, you can torture statistics until they tell you anything that you want. But so right from the word go, that trial, if you looked at it properly, was waving red flags all over the place.
So it was sold as 95% effective, first up. I think Joe Biden said, you take this, though he doesn't know what he's saying, it's obvious. If you take this, you won't get it. He said that verbatim. I've seen it, unless it's an AI'd picture. That's what he said.
No, he did. And he's not the only one either.
Then when it became clear, because we're slightly behind the timeline on the rest of the world, and that was that supply thing that you talked about before, then it started to come through that, no, it doesn't actually protect you. It doesn't stop you from getting it. Or if it does, it's a very small number, it seems, and I think we can safely say that. It's quite widespread, its failure in doing that. Not only that, that it would be good for the virus going forward. And we've had variants since then, which I take it the current one isn't. I think it's a computer designed piece of code, isn't it? Fundamentally, the mRNA.
Well, the sequenced code that was supposedly from the COVID-19 virus, which has never, to my knowledge, actually been identified or isolated anywhere yet, and that's just the truth, was uploaded by the Chinese.
Yeah.
And they said, here's the code, and do your worst.
Yeah, and they got on the PC, made the molecules or whatever, and outputted the product. Is that it?
Yeah, and it turned out it wasn't actually the full code. It was a best guess, and they stuck some other bits in that they thought would probably be where,
just
a bit of this and a bit of that.
Throw this in. And so it moved from that sort of almost categorical reassurance that you take this, you won't get it. Then it was modified to prevent severe hospitalizations and illness, or severe illness and hospitalizations. That should have rung bells, shouldn't it? That modification of the sales pitch.
Yeah, well, there's been a sort of slippery slope.
But people quote that now, like,
well, it seems to me it's the last thing they've got to hang on to. And I mean, and you've had guests in here that have said, look, you're 10 times more likely to die if you're unvaccinated. And it's become very clear how they can say that now.
Oh, how do they say it? How can they?
Well, it's how you define what vaccinated means. I mean, if you're looking at safety, it ought to mean the moment the first jab goes into your arm.
Right.
The clock starts ticking, and you should be watched like a hawk.
Are
which
there
is what
other
happens in a
vaccines
clinical trial.
with multiple stages? I know you get your booster for tetanus or something, for step on a nail, and it was 10 years ago. But, and sorry to jump in on there, but are there vaccines in the past where it requires, it's a flu vaccine, I suppose, multiple stages ongoing?
Yeah, I mean, certainly the childhood vaccinations, the ones you have in the first year of life.
Of course.
You have typically 3 doses are required and then a booster. So that's we're used to that, and that's usually may take a couple of goes to generate a sustained immune response. But again, we have to come back to the fact this isn't a traditional vaccine. It's never been used to raise immunity to infectious agent before, and you can quibble all you like, but the fact is this is an experiment in terms of the amount of time we've got to draw data from that this thing is being used in humans. There were no animal trials, not the ones you would normally expect. There were no, human trials for at least a few years. I mean, the clinical trial, the official Pfizer trial, is still going on, and it's being put back. It's not due now, I think, to finish until I think it's early 2024. Could be late 2023 or 2024. So, by definition, this is not a fully registered medical product with all the data that would imply, and to say otherwise is just not correct. And we were told that from the word go. And in fact, a number of us, we received our consent forms when we were the first wave as frontline workers to be offered the vaccine. In fact, we'd already been instructed that we were to have the vaccine, actually. And there in black and white was some statement, this vaccine's been tested to the same standards as every other vaccine. Well, no, it hasn't. I mean, that was a barefaced...
They knew that. How could you not know that?
Well, look, I think it slipped by a lot of people because of the use of the word vaccine.
Ah, right.
This is certainly...
Boy, that's easy then.
Doctors I've spoken to, have said exactly that. And in fact, some of my colleagues who...
But where's their critical
they didn't even know
observation? How it worked. Did they not do their own research? Or do you just assume everything's...
Humans are basically good and trusting people.
Right.
And if you don't have a precedent for this type of thing to be slipped past you, and you've already been not only scared, but you've been locked up, disempowered, and had this relentless barrage of fear propaganda.
You just want it over.
You do, absolutely. And you want to do the right thing, of course,
Yeah.
for your patients and to set an example in the community. But, one of our strong things is that we have a responsibility not just to our individual patients, but actually to the community as a whole. And we should be acting as, sentries or gatekeepers for what's going on, and to shout out if we see that there are problems. And even before the vaccine rollout in New Zealand, it was very clear that the injury rate, the reports of adverse effects were off the chart already in other countries compared to what we've ever seen before.
Okay, well, that again, same kind of question. The geniuses in the Ministry of Health and the politicians running the response, etc., have access, surely, to this information.
Well, again, you'd have to ask them
No, I know,
why
but,
they choose not to act.
Well, what possible answers could there be?
Well, we'd just be speculating, and that's not fair on your listeners for me to
No,
speculate. But there is reasons, and there are a lot to do with psychology. There are a lot to do with finance. And I think a lot of people don't understand the vulnerability that nation states have to corporates under sort of the current WTO rules and the banking system. Things have changed a lot in the last sort of 10 years in favor of the rights of corporations that are allowed to have the same rights and freedoms as an individual. And so, New Zealand's a small country. Pfizer's huge.
Yeah.
So presumably there would be a major disadvantage. And we know from some other countries that they've had to offer up huge collateral to the drug companies providing the vaccines in the event that they renege on their deals. So we think there's a lot of fear around what might happen to the country.
So we went through that phase of being persuaded that this was going to be a good thing and this is going to get us out of this pandemic situation, and people bought in and did the good thing, and I think most people were good-natured. I don't think they're that stupid, but they did want to do the right thing. I saw that. I'm sure you saw that. But then things tightened even more. Now you're having your movement inhibited, or you're having your job, facing a job loss, career loss. They don't care that you've got kids and mortgage to pay. They don't give a damn. Obviously, right? They didn't care. In fact, they thought, that's your punishment. You deserve that. So what happened? How do you think, from your observation of all of this going along, how did we get into that hardening of the heart situation, do you think?
And that's such an important question, Paul. You don't have to look very far back in history to see the same thing happening over and over again, all the way through the 20th century. Previously, sort of functional societies just suddenly caved, and then you have a totalitarian, iron-fisted, cold-hearted regime that actually saw the death of over 100 million people at the hands of their own governments in the 20th century. Now, we'll think, it'll never happen here. It could never happen here. But human psychology is the same the world over. And there are always people who are immune to the suffering of others and who believe that they know best, and the rest of us can just get stuffed at the feet of some agenda, some ideology. I don't know. I honestly don't. But I know that human psychology is vulnerable to being played. And I think that we've all been played with a military-grade psychological operation that has seen us, dance to the tunes that we've been given. And your point about cruelty, as doctors, it is indisputable to us that there are injured people from the vaccine, and there are people that have lost their lives. There just is no doubt about that.
Avoiding that, want to get onto that.
The point here is that the way these people have been treated, the ability to get an exemption when you've plainly suffered a significant adverse effect after your first or second jab, they're just not being given. There is a cruel and hard-hearted, black and white approach that speaks volumes, I think, and it tells us that we're in a different, we're on a different planet now.
Because that's kind of evil.
That might be one interpretation.
Well, it's mine.
Yeah.
It comes to mind because it's brutal. You must have to have blocked out everything else in your thinking and be so focused on this one thing, getting back to that word, that you're so possessed by it that you don't care what happens to anyone that disagrees with you. They can die as far as you're concerned.
But isn't that what ideology and dogma does to people?
But to that level.
Well, as I say, 100 million people plus.
Why don't you talked about exemptions for people who've been injured. Why would they be so ball-breaking about that?
That's a really good question because, we know that there are other changes being mooted in the way that we live. There are a move towards a, centralized digital currency and the Internet of Things and the sort of the fifth generation technology, wireless technology, has huge potential to change the way that we live and actually to limit the way we live too. And in order to sort of to do that, you've got to get people signed into it. And I wonder whether, it's not about the vaccines.
It's a psyop.
Because if it was, you could easily build into an electronic system the ability for people to have exemptions. But given that so many people are getting cardiac inflammation, neurological disorders, and things that may well be with them for a long, long time, many of which actually ACC have been turning down, although there's been a recent sudden change of heart, which is interesting.
Oh, really?
Which we can talk about if you like.
No, we can. But there'd be a strain on the budget after a certain level.
Absolutely. It's already, we were already struggling, of course. We know that with the health budget before COVID came along. But I don't think that they anticipated the extent of vaccine injury and deaths that they would see. I really don't. And about halfway through last year, a guy called Byron Bridle, who makes vaccines for a living, he said, look, we've got it wrong. We've made a real mistake about the bit of the virus that we've chosen, the spike protein, to get the body to make for itself, because that's actually the disease-causing part of the SARS-CoV-2 virus. We've just made a mistake, so we should recognize that, stop, and reverse tracks. So that's when his career started to go down the tubes.
Right.
But he was just trying to give a warning.
So anyone who's going to talk in the face of this is probably a gone burger, really, even now?
Well, I mean, it's very easy to chuck these labels around, conspiracy theorists and
I hear it all the time.
As a way of just diminishing somebody who says something that makes you feel uncomfortable.
Yeah.
But the point about ACC is that there are some, really angry and quite well-resourced people who've been injured by the vaccine, who've actually been turned down. And the thing about ACC, it provides protection or a liability protection for the health providers,
right?
Because the no fault compensation sort of umbrella that the ACC insurance gives means that you don't have to sue somebody who's injured you because you can get compensation. But if you get turned down for compensation and ACC does not register your vaccine injury, that means that you actually have the right to take a private prosecution and to start getting
and this is what's happening now.
And I have a feeling that there's been a recognition of this because providers have been getting letters from ACC saying, don't expect that a lot of these cases are going to be accepted because it's quite a high standard to prove a vaccine injury, and it is. But there's been a change now, and I think that's probably what's going on.
I've had 3 friends die in the last 2 months.
3 friends?
Die.
Oh, God.
The last 3 months. Thank you. 49, 71, and 50. The most recent, 50, very good mate, was in great health, it seemed. He really was, and he looked after himself. I knew what he did. Now, that may be a coincidence that happens in a life. It's never happened before for me, and maybe we get to probably similar age range. We get to this stage in life, and we're going to see a bit of that.
Yeah, well, look, those of us that have been working as doctors in the community...
It makes me start to think.
It should.
So...
We know this isn't normal, Paul. There's nothing normal about the extent of younger people who are dying.
What is the scale of it?
Insurance companies are the places to really get the hard truth, because they are warning their investors ahead of time, because they get prosecuted if they don't, about significant changes in their business or their outlook. And there are some really big insurance companies that have come out, one in Germany, one in fact 2 now in the States, that are reporting between 20 and 40% increase in all-cause mortality or death rates in the working age group. So this is basically 20 to 50. And in fact, the CDC itself looked at some figures, and they found that between 24 and 49, there was a 70%, 74% increase. Now, 20% might not sound a lot, but it's huge, actually, for what are called standardized mortality rates, because, it's very consistent, who dies of what from year to year. There can be a variation, week to week or month to month. Obviously, you see more people dying in the colder months.
Yeah.
And generally, most people who die are expected to die. They're elderly. They've got a terminal disease.
It's no big surprise.
Yeah. But what is different is the number of young people who are dying in their sleep, dropping dead, and within 1, 2, 3 days, 7 days of a vaccine, it is sticking out like a sore thumb. And you can politic this as much as you want. And ignore it, but more and more people are, know somebody, or know somebody who knows somebody to whom this has happened, and for every one unexplained sudden death in a previously well person, there are X number of 10 to 100 times injuries as well that again you would not expect to happen. Some people are wandering around, as a volcano waiting to blow. They've got all the risk factors for Africa, but many aren't. And as doctors that have worked in their communities for decades, me and my colleagues, we have no doubt that there is something really bad going on. And we talk a lot about the elephant in the room, and the emperor has no clothes. And these parables, have stood the test of time because they reflect elements of human psychology.
Right, they don't go away.
Allow us to use denial. And obfuscation and things to reject unpleasant thoughts. And the worst thing that can happen to a human is that they can be, shamed for making a mistake.
Yeah,
and people will go to the ends of the earth to reject that.
Big time, we've seen that. Again, I sort of recognise news patterns because I've been in it so long, and we're pattern recognition machines ultimately, aren't we?
We are. Yeah.
One thing I've noticed too, and this is what I wonder about the safety of things now, is that there have been a lot of car crashes where people have driven off the road that haven't involved other cars. In my experience of reporting endless car accidents, it's usually 2 vehicles involved. You don't just drive off into the lake. I've noticed that recently. And also I've seen quite a bit of debate coming out of the States regards very crucial workers like airline pilots. Do we want to be in a plane where the guy falls on the controls at 100 feet in a 60-knot nor'wester coming into Wellington?
Of course we don't.
So why are we willing to... I could be wrong, I'm barking up the wrong tree, but why are we willing to take these risks and impose them on people?
Well, I think many of us don't realise, it's not put in that way to us, and we don't realise that we are taking those risks. But if regulators are, then there is clearly something else going on. There is something much bigger at play. There has to be.
Because it's hard to explain it any other way, right?
Yeah, the most safety-conscious industry on the planet.
Yeah, for good reason.
And they are, lowering the bar left, right, and centre for monitoring people. that have been vaccinated.
And those who are having trouble will not come forward because they'll lose in this case, they'll lose their medical, they'll lose their career.
There are many
mortgage,
pilots that say
kids,
that.
There
are many pilots that say that. And there have been some fairly high-profile,
potentially.
near disasters already.
Yeah, there's a few in America. I follow that quite closely. Want to get on to the messaging, because I find this fascinating. The persuasion. And you mentioned military grade, I think, when we were talking before. There does seem to be, and they're smart people, they know what they're doing. There seems to be, this hasn't been a random set of messages, it seems to me. It's been too anticipatorial. Is that the word? It's kind of like they've anticipated, whoever they are, the next move, and are kind of ahead of where the psychology is about to be, sort of one or two steps ahead. And that speaks to me of a systematic, military grade approach to manipulating psychology. Is that what you think?
It's what I think personally, because there is such a sort of lockstep synchrony with what's happened in other countries. And that might not be the explanation, but there's an explanation somewhere for the facts that we see, which is in the face of overwhelming evidence of harm, an unprecedented amount of harm from this medical product that we've never seen before. They're still barreling on.
Well, they're saying get boosted, and
it's desperately sad.
Correct me if I'm wrong. This original vaccine is not even made for variants, and we're getting hit with all sorts of variants, and they're saying getting boosted. But hang on, does it work? And if it doesn't, against these, why are you pushing it? Is that a psychological operation?
Well, again, you just have to try and work out for yourself, what the blanks are.
Yeah.
But, the very fact of all these variants was predicted if you vaccinate when there is lots of virus around. We never wait to see if there's going to be a flu epidemic in any particular winter and then start vaccinating, because that's how you encourage mutation in the virus. You do it in the autumn, basically. March, April, we're starting to think about the flu vaccine campaigns, and we may not see it till sort of September in some years. So if you start raising antibodies to a virus that's already in the population, you're going to see variants. And the natural history of respiratory virus pathogens has always been, they come and they burn through the population and they're gone 6 weeks, 8 weeks, something like that, because they've infected the vulnerable and people have developed their immunity, and then it can't jump between people anymore. And what we've seen is this succession of variants that each of them have arisen in a country that was starting to roll out its vaccine. And in fact, if you look at almost every country where there are statistics, you see the waves of COVID, the really significant ones, second, third, fourth, matching the vaccine programs. And that's, you can come up with any explanation you like, and you can belittle people who mention it, but that's the emperor has no clothes thing. You can look at the data and you can ignore it, or you can try and understand it and produce an explanation. And it may be unpalatable for people in power, but that doesn't change what the data says.
And they're still going to have to deal with it. There will be consequences from this. There's no doubt about it. There's got to be. There'll be fallout. I don't know what it'll be, but I sense it's there. Have you ever been interviewed like this on a mainstream media channel?
Oh, never. I mean, we've been hoping to. And
what happens?
And we've asked for debates as well.
And?
No one takes us up.
Why?
And that's been true. Well, you'd have to ask them, Paul.
But you've been in the game a bit. You must have a gut as to why that is, because normally that's what the media is there. You're supposed to have open discussion about things, and the best ideas win, the strongest debater wins, whatever. But you do it, and that's what the whole fundamental tenet of journalism, current affairs, has always been. Certainly with the people I used to work with in newsrooms, and science,
and it's gone. It's been eradicated.
So, what's the media's part of this? Because we've got a slick psychological operation going somewhere. By who, I don't know, but. You mentioned lockstep. There seems to be a lockstep too with media. They are obeying or omitting a lot of what should be the coverage. And now, you must have done some thinking about that.
Yeah, I mean, I think, but it's speculation, and it's one of the things that somebody like me, is acutely sensitive to, having it turned against me.
Yeah.
That doesn't stop me having my views.
No.
But it's not always.
But it's a reasonable question to ask.
Yeah, it is, absolutely. Well, I'm sure some of your listeners or people that ring in will have a variety of views on that. But you can't ignore or pretend that history didn't happen. And a good example is, I can't remember the name of it now, but in the early 30s, a German newspaper appeared whose sole job was to criticize the Jews and to play their part in turning the population gradually against this group of people who, over a number of years became demonized and dehumanized. So that then, when the atrocities really started happening, nobody batted an eyelid.
They were desensitized to a level. But
it took a number of years to get to that place. So it has happened before. So we can't pretend that it might not be happening now or that it won't happen in the future. It's certainly a possibility. And people need to be awake to that. There's always been a streak, an instinct for totalitarianism that's run through humanity. And some people just lack the capacity to relate to the suffering of other people. They're just born without something that the rest of us have. And we don't spot them. They can be among us.
Until this.
Because we're relating to them as if they're us. So we don't think to look for, the lack of things. And the smart ones learn to say the right things and to pretend that they're the same as us. But they're actually, it's not their fault almost. They can't help themselves. They just are who they are.
Yeah.
And these people can end up in positions of power and authority. And it's happened over and over. And many of us, we just want to know who the boss is and what the rules are. And if it all seems to make sense and we seem to get along, then we're happy.
This may be a big, I don't know if you've thought about this too much, but this may be a big problem for the nation. If this is found out to be an epic cluster beat, all right, we'll know who is responsible. We know who made those decisions, who made those recommendations. Okay, we might not see a contract now, but we might see that contract. We should see that contract. I mean, we're paying the money. Nurses, doctors have injected people. Let's say there's a real downside. I mean, sending some to not a nice outcome. How do you deal with the accountability? Have you thought about that?
I try not to think about it because I'm an optimist, and I think this is, we're going to sort this out. The people will solve it.
Right.
I just hope it's sooner rather than later. But there are, lots of really good people who are just unwitting, I think, in this.
Do you think it's starting to give? Is it, the whole dam starting to creak and groan?
I do, actually. I do. Certainly at the freedom protests in Wellington, probably the majority of people that came up to talk to me, to share their stories, were people who actually had vaccine injuries. So they'd been vaccinated.
Oh.
But they'd woken up. And I just wanted to come back to this point I made about how you define vaccinated and unvaccinated. The reason that some of the data supposedly has shown that the unvaccinated are so much more vulnerable is that you're not considered fully vaccinated until maybe a couple of weeks after your first dose. And then after your second, again, you
So it's a technical tweak.
Oh, look, absolutely, but it can hide a huge amounts of harm and seem to lump it into the unvaccinated
group. And give
group.
a plausible deniability when being questioned.
But if you define it properly from the moment that jab goes in the arm, and look at what happens, actually the statistics flip.
Yeah.
And it does show that the unvaccinated actually are not big users of the health system and do not have poor outcomes.
We've got 6 minutes left. I saw a list the other day that I think was part of a list or database that has been set up by, I think, your organisation.
Oh, yes, yeah.
I must tear up talking about this. I looked through there and there were dozens and dozens of names. 13, 17, 18 years, 21, 32, 55. Just went on and bloody on.
Yep. It's heartbreaking, absolutely heartbreaking. And we're not saying that the vaccine killed these people.
But something's up, man.
We're saying they died shortly following a vaccine, and they need to be investigated, because if there's a problem, how the hell are we going to know if people don't do their jobs and investigate properly? So the police have had this information.
What do they make of it?
They can't get their heads around it. I think,
Really?
you know, we've had a couple of derisory responses. Most of the time, MedSafe and the police basically just ignore it. What the police said was, well, frankly, this is preposterous. We can't believe what you're saying. So they went and had a look, and they said, well, MedSafe has plenty of data to refute what you're saying. And the reason we've written is that they plainly don't have the data. You know, there's 160, I think, deaths that have been reported to MedSafe post-vaccination. We've got around about 500 names, and we only pulled 160 of the younger ones, predominantly, that we felt, you know, made a really strong case for proper investigation, just in case. And of the 160 that MedSafe have through the CALM system, they're saying 48 of those don't have enough information to investigate. So they're just not investigating. Well, they should go and get the information. That's what they're there for. And they could use the police to do that too. So, you know, it's part of this. If they just ignore inconvenient information and don't respond to us and our annoying questions, then the questions will go away. But they're not going to, because we have an obligation. No matter what happens to us personally, you know, we're all, you know, there's only one way we can proceed, and that's forward, trying to figure out what the truth is and telling it to people, and not worrying about, you know, where the chips will fall. It's not our job to control people's reactions to unpleasant information, but we've got to get the people who we pay to regulate and protect us to do their jobs. That's all we've ever asked for.
Meantime, you've got families who are going, what the hell happened here? And they're going to get angry, aren't they, at some point?
Well, it's part of the normal grieving process to go through that process. But
here's a question.
But it's much more complicated than that, though, because it's in an environment where there's already so much fear. And I think that for a lot of these families and partners, you know, they're on their knees psychologically. They've had the worst thing that can happen to a human being, which is to lose a loved one, or, you know, a young person, or,
especially
or something. And now we're saying, you know, you have to stand up and risk losing your peer group, losing your friends, losing your family.
Oh, that's such a terrible thing.
By asking hard questions. If you know that most of your people, your peers, wouldn't support you in doing that. People can't go there. You know, they just know that they need the people around them, and they're not going to rock the boat, maybe till later on. I think that's one of the explanations. You know, I'm sure there are others, and there are people actually who are trying to get, you know, they're appealing the coroner's reports, and they're trying to get medical information, and they're asking questions. You know, so the dam will break. It has to.
This hour's gone so quick. We've got about a minute left. How long do you think this is going to run?
I don't know. You know, it's one of the most, you know, enabling responses to any question for a doctor to be able to give, actually, which is, I don't know. Because there's a lot of stuff we don't know.
Of course.
I can't see our country putting up for too much longer with restrictions on our freedom being probably put in danger from this medical treatment without calling for accountability and starting to resist. And there's a steady stream of very smart voices, you know, who are getting a wider and wider audience for their writings and things. And people are waking up to the bigger picture, because I think there has to be one, because, you know, COVID-19 can't continue to be the world's, you know, leading cause of coincidences. You know, we're expected to swallow so much as just being a coincidence. You know, and any one of these things on their own you could maybe dismiss, but put it all together, and there's some bad stuff happening.
Dr. Matt Shelton of NZD SOS, thank you for coming in.
You're very welcome. Thanks for having me.
And let's see what happens. Huh?